Hello and welcome everyone to UNSHAME Kentucky's October webinar, Grassroots Advocacy for Addiction Prevention, Treatment, and Recovery. My name is Michelle Juma, Project Management Specialist at Shatterproof, and today we have a fantastic 60-minute presentation for you all. But to see who's in the room, please feel free to put your name, your city, your organization in the chat box. This event is being recorded and will be available on UNSHAME Kentucky's events page on the website, along with a copy of the presentation. All attendees will be muted throughout the session, but feel free to submit questions using the Q&A feature at the bottom of your screen, and we will answer all that we can with the time available following the formal presentation. Our interpreters will remain spotlighted throughout the event, but if you have any trouble viewing, please shift to speaker view or from speaker view to gallery view, and folks will show up on the right side of the screen. Closed captioning is also available by selecting the closed caption button towards the bottom of your screen. The UNSHAME Kentucky webinar series is brought to you in partnership with Kentucky Opioid Response Effort and Shatterproof, and a special thanks to the Kentucky Office of Vocational Rehabilitation for providing ASL interpreting services for this event and all future webinars in the UNSHAME Kentucky series. Our agenda today will include our welcome and some housekeeping. I'll introduce our speaker to do the formal presentation and then question and answer before closing at 2 p.m. Eastern Time. As you close out of today's session, a survey will appear on screen, so please take the time to complete it. We'd love to hear new ways that we can improve the offerings throughout the campaign and get more folks involved. If this is your first webinar, then UNSHAME Kentucky is a 12-month evidence-based behavior change intervention aimed to reduce the addiction-related stigma held by Kentuckians. Again, this campaign is brought to you by Shatterproof in partnership with CORE and is supported through the SAMHSA grant for the 12-month duration. We're working to achieve several goals in our campaign, including increasing knowledge about opioid use disorder. Again, that recovery is not only possible, but probable. We are working to improve attitudes towards those living with or in recovery from opioid use disorder and develop Kentuckians' understanding of this disease. To accomplish these goals, we have 3 approaches or pillars that we like to examine: community connection, storytelling, and education. Prior to our launch, there was a community needs assessment and regular outreach to understand the climate and opportunities that we're able to improve on. In collecting stories, we're centering the experiences of people, friends, family in recovery, and the practitioners who are treatment providers who are working in this community every day and are becoming advocates on their own to put a face to this disease and help folks better understand the crisis. And through our education pillar, we are hoping to use materials and resources like this webinar to help a community understand the opportunities that are available to them and spread anti-stigma messaging to target audiences. So without further ado, I will introduce today's speaker. All right, Tara Mosley Hyde holds a dual master's degree from American University School of Public Health, focused on public administration and public policy. And she was recently welcomed as the new CEO of People Advocating Recovery. Tara continues to assist in the development of policies and procedures and has worked with SAMHSA, Brass Tacks, Development of Corrections, and other state agencies, such as the Department of Behavioral Health, to design a standard for recovery peer support services for youth, young adults, and justice-involved persons, while bringing awareness of recovery-centered approaches across the country to every sector. Thank you, Tara. Please feel free to begin your presentation.
Thank you so much. I'm so excited to be here, and I think we have a lot to cover, so I want to make sure that we kind of jump right in. So I'm just going to share my screen. Give me just a moment while we make that happen. And I'm overwhelmed by all of the responses in the chat box. So thank you all so much for sharing that information of who you're with. So we kind of get a lay of the land and the landscape of who's all attending today. All right, so I'm going to go ahead and get started, and I will introduce myself again a little bit, just so that way you guys can get to know me, just as a facilitator and presenter. My name is Tara Mosley Hyde, and I am the CEO of People Advocating Recovery. I am also a person in long-term recovery, which means to me, I've lived a life of resilience since April of 2011. And what that looks like for me is that I got involved in advocacy really early in my life. I was 23 years old when I came into recovery. And as a young person, I recognized a lot of barriers that, were placed in front of me as I was trying to identify resources and services that I could access. And due to those barriers and challenges, that's kind of where my life of advocacy started, because I was that person that needed it, So as we kind of go through this presentation, it is a lot of legalese and legal understanding, but also kind of think about some of the things that you have experienced, or things that the folks that you work with have experienced, and identify some of those gaps, identify some of those challenges to help other people, hopefully in the future, so that way that they won't be faced with the same challenges that either you or the people you serve have. All right, so just to get into it, these statements, there's always going to be a disclaimer anytime that we talk about, legal issues. And, I am not an attorney. I don't represent you. And I do not have I'm not a JD, so a Juris Doctorate. So, this is in no way legal advice. If you have a specific circumstance to address, you should contact your legal counsel, any local legal counsel. But, you can take this information and kind of, again, just a look at your personal experience and how you can use knowledge as a weapon to, change the policy landscape in your community. So the objectives that we're going to kind of cover today, again, this is like a 101 level. So very, very broad overview and a broad brush stroke of advocacy and understanding the lay of the land. So understanding discrimination against people with substance use disorders, review of the federal and state laws around substance use and protections, identifying strategies to build an advocacy coalition through partnerships and shared policy agendas, and connecting to additional resources on harm reduction care models, language trainings, and educational resources. And I did put just a little line item at the bottom. So this was actually prepared by Legal Action Center in collaboration with Partners for Recovery, People Advocating Recovery, and the initiative of the Center for Substance Abuse Treatment. So what is discrimination? So treating a person less favorably, differently, or because his or her status. So when the law does not permit it. So examples of status protected by law is race, age, disability, gender, and criminal records in some certain employment contexts. So some examples of that: doctor's office won't treat someone with a drug problem. An employer fires someone because that person is in recovery from alcoholism. State government employer has a policy: we don't hire anyone with a criminal record, no matter what it is, what or was for, or how it is today. So in some of those reasons, it's just because it is too all-encompassing and too generalized, or a doctor's office won't treat someone with a drug problem. That in lies like the Hippocratic Oath that a doctor takes, for example. An employer fires someone because that person is in recovery from alcoholism, because being in recovery is a diagnosis. They can't discriminate against someone based on a disability, for example, as we just referenced before. And state government employer has a policy: we don't hire anyone because of a criminal record. That also, unless there is some sort of reason because they were working with a vulnerable population like youth, or some, other situation that says like that an individual can't work at that organization, business, company, due to the persons that they serve or what have you. There has to be some underlying reason. They can't just make a very generalized sort of policy like that. So look at each person individually and should not make generalizations about a person based on status. Again, discrimination is not treating a person less favorably or differently because his or her conduct. So, and some examples of that. So fire a person who causes an accident at work because he or she is under the influence of alcohol or drugs. So, and this is a continuous conversation, I think. So for some examples, like if somebody were to, cause an accident at work, I'm trying to think of a good example here. If somebody was a forklift driver at a warehouse and they ran over a bunch of boxes and destroyed a bunch of products, and because they were under the influence of drugs or alcohol, they are not protected due to the fact they have a disability, for example, because they put themselves and their company at risk when they started to consume alcohol and or drugs on property. Those are just some examples. Evict a tenant who has been found guilty of selling drugs out of his apartment. So why this would not be discrimination is because selling drugs is an illegal activity, which falls under criminal code, which then gives that landlord the right to then evict that person. So understanding laws that protect people with alcohol and drug histories from discrimination. So the American with Disabilities Act, the ADA, some of you guys may be familiar, Section 504 of the Rehabilitation Act, the Mental Health Parity and Addiction Equity Act, the 21st Century Cures Act, Fair Housing Amendments Act, Workforce Investment Act, and Family and Medical Leave Act. And I'll go into a lot more detail here in just a moment. And we'll go over it. And this is a very text heavy slide. So just we'll go through it together. So the ADA, these are again from a very broad stroke that offer protections to people with disabilities. So each of these areas focus on protections within those spaces, just to kind of give you a context here. So Americans with Disabilities Act, they protect private employers with more than 15 individuals. They protect people with disabilities, excuse me. So private employers with more than 15 employees, state and local government agencies, places of public accommodations, and private entities open to public. So hospitals, so entities that have public spaces. So hospitals, doctors' offices, daycares, hotels, anywhere with a public. That's why, like, for example, an easy reference would be like making sure that there are wheelchair accessible spaces into hotels and, and that's just an easy one to kind of understand and reference. But there also is protections for people with a disability, for example, from substance use, right? Like we are also afforded the same sort of spaces in each of these contexts. So the Rehabilitation Act, which states that federal government groups, agencies, and programs that receive federal funding, either directly or indirectly, are also required to have protections for folks with disability. The Fair Housing Amendments Act, for example, private housing, which again, like you can't discriminate against somebody applying for loan based off of a disability, same way as housing providers, so landlords, etc., who receive federal financial assistance. State and local government housing authorities, certain real estate brokers also fall in that category. Workers Investment Act provides job training and placement services through one-stop career centers, applies to public job training and federally funded job trainings, and must provide services to qualified persons if not currently using illegal drugs. And we'll kind of get into the nitty-gritty of what is protected and what isn't protected. But again, it's always going to be a case-by-case basis. Nobody ever automatically opts in and it's automatically protected. Family and Medical Leave Act. So 12 weeks, and I'm sure if most of the parents probably on this call may know, 12 weeks of unpaid leave in 12-month period for serious health conditions, includes substance use, must have worked for 12 months, worked at least 1,250 hours, work side of at least 50 employees. Employer cannot deny leave or take action against employee for requesting or taking leave. So if somebody were to come to their employer who always showed up on time, never missed work, or had always an excused absence, they came to you and said, I need to take leave, and because that person may need to go to a treatment center or take some sort of action for their health, an employer cannot discriminate against you from being able to utilize that protection. So again, and it is there are certain stipulations there, and and I referenced parents right before we went over this, and that's because especially for moms, there is that's a protection from them when they take leave for having a child after they have the child. You have like 6 to 12 weeks depending on lots of different variations of paid and or unpaid leave through that act as well. State laws, so some that's really specific to Kentucky. So the Kentucky Civil Rights Act, Senate Bill 192 from 2015, which expanded Narcan access, the Good Samaritan law. And just for a quick reference, so the Narcan expansion, Narcan is actually, it's always really been around and available. It's just not been like publicly accessible. And so now it has been expanded to where there's a standing order in the state where folks can go to any like CVS or any other pharmacy and be able to access Narcan through that order. And through CORE, who I do believe works with Shatterproof for this presentation today, has helped to try to lower the cost of Narcan. That's directly from the Pharmaceutical Association. So you can go to your local CVS or Kroger or wherever and probably get a discount as long as you use the information from the CORE website. And you can also utilize, I'm sure there's a bunch of harm reduction folks on this call that I saw in the chat feature. And you can gain access to Narcan, which everybody should have. The Good Samaritan law, which protects people who call in the event that someone is experiencing an overdose. So what that would look like is somebody could call EMS and, whether they are somebody that they themselves is also using any substances or if they're a bystander, they can just call 911, give their name, say that they, believe that this person is experiencing an overdose. And wait till EMS arrives. And that law protects them from any sort of persecution because drugs, paraphernalia, etc., may be on scene and will not be charged. Syringe exchange. This is now available throughout the state of Kentucky. A lot of counties have opted to have syringe exchange access where folks can go to, your local harm reduction coalitions or public health agencies, health departments, etc., to receive syringes and other services and supplies for safe use. So, and what that could look like is somebody who would come to a syringe exchange, they would either surrender any used syringes so that way they're disposed of properly and not just discarded in the street. And they can then get clean syringes. They can also get anything that's for like wound care or to be able to properly use in a way that's sterile and clean, so that stops the transmission of HIV, hepatitis C, lots of other bloodborne illnesses. So it's a really great program as well. And then changes to the criminal code. So something else that was adopted in that legislation was changes to the criminal code, which enhanced charges for somebody who was trafficking or who is perceived as trafficking. I can't ever say, allegedly, I guess is the proper term. But so changes to the criminal code in that response. And it's all contingent on like the amount and the scenario in which someone may be having possession of that substance, whether it's in several different baggies or, whatever. And it is always typically discretionary of the police officer who may be interacting with that individual. Local ordinances. So Lexington, Louisville, and Covington are just some examples, just any of the greater cities that could adopt specific ordinances for their communities and their cities. And that could look like zoning, allowing for more recovery residences in their communities. That could look like ensuring that any new treatment or new RCOs, recovery community organizations that come up have more inclusive language, like saying, to abolish the term substance abuse and that sort of thing from being, allowed in their title of a company or business or practice. So some different things like that. All right, part 3, who is protected? Now, this is kind of getting into the category of where those protections fall in line with people who have a substance use disorder. So what it is the definition of a disability, a physical or mental impairment that substantially limits one or more major life activities or a record of such an impairment or being regarded as having such an impairment. Again, legalese, I know, but this is kind of what it breaks down to be. Major life activities include caring for someone, walking, talking, or working. And again, there's no automatic disability, so it's always going to be a case-by-case basis. But again, we're talking about the status of an individual, not the conduct. So just keep that in the frame of your mind as we kind of go through. So who and what is protected? The case for alcohol use disorder being protected from discrimination. Past consumption, oftentimes, yes, it is protected. Again, from status discrimination, not conduct. So driving under the influence, not protected, right? That is a criminal violation. So you will be charged as such. But if you are fired because you used to have an alcohol use disorder and you are now in recovery, they can't fire you for that. That is a protection for you. And current consumption oftentimes is still protected, and that is because of the ADA, Americans with Disabilities Act, because alcohol is not as stigmatized as substance use. So if you were to go to your employer and say, or your landlord, employer, etc., and you're at home, you're in the confines of your safe space, and you call them and say, I have an alcohol use disorder, I need to go into treatment, you can still take leave from work and still do all of those same procedures, whereas you may not be able to utilize that protection, as we'll kind of get to this next slide. Because drugs and or illicit drugs, I should say, are not protected because they are illicit, they are illegal. So that is not protected due to the criminal nature of illicit drugs. And it's outlined specifically in the statute that illegal drug use is not protected under the ADA. But again, like past addiction is oftentimes still protected, even though you may be recovering from illicit drug use. Nonetheless, this is still a very gray area, and again, it's always going to be a case-by-case basis. But that's kind of a broad brushstroke, if you will. We're doing okay on time. Who and what is protected? So healthcare providers exception. So people who are currently using drugs are protected from discrimination by healthcare providers if otherwise entitled to such services. So if somebody has dental insurance, a provider can't deny you because they are using cocaine, for example. So the rights of persons with past or current alcohol drug use disorder covers 3 main areas: employment, housing, government services, and programs. So the basics: no discrimination against a qualified individual with a disability. So they can't deny a job or fire someone if they are in treatment or in recovery specifically, and must provide reasonable accommodations, and must limit questions about about their history or any tests for disabilities, and must keep health information confidential. So housing rights, some of the basics there, can't discriminate due to disability in rental or sales. The Miss Murphy exception, so owner occupied and 4 units or less. So like recovery residences, but those usually don't discriminate. But places that are like your duplex, excuse me, are more likely to be protected renter spaces. Applies to most public and private housing, doesn't protect direct threat to health or safety of others who would be harmed by, the property. So again, like that looks like somebody who may be selling illicit drugs, or having a house party, like that obviously is not protected. Government services and programs. So government agencies may not discriminate against a person with disabilities. And that's like, from the federal protections that we had talked about from the ADA, can require participation in treatment programs as a condition of receipt of services. So like for SNAP benefits or housing subsidies, Medicaid. Although government agencies cannot discriminate, they have policies that limit eligibility for people who have a past criminal history. So, there may be like for a good one that kind of needs to change is, for example, people who apply for student loans, or for a FAFSA, you are ineligible for federal Pell Grant if you were on the Pell Grant and were convicted of a felony drug charge. That makes you ineligible to receive any sort of government funding for schooling. So, things like that. There are some limitations. So responding to violations of your rights under the federal anti-discrimination laws. So how to respond, right? Like, so something did happen to you, say something did happen to you, you were fired because they found out that you are in recovery. How do you resolve that matter, or what do you do? Do you escalate? What do you do? So there are a couple of options. So informal resolution, education and information, complaints, and court actions. So some complaints that you can file. So you can actually file a discrimination complaint with the Office of Civil Rights or federal government agency that is charged with enforcing the anti-discrimination laws. You do not need a lawyer to do this because it's just a complaint. It's just a written documentation of the complaint that's being made. Court actions, however, that you will need an attorney for because that's escalating. So in most cases, you can file a discrimination lawsuit in federal court in addition to or instead of filing an administrative complaint. But most of the time, depending on what type of case it is, you may have to exhaust administrative remedies. So meaning that you file your complaint or, maybe you have experienced harassment, or there's lots of different variations. Again, I don't want to like kind of just throw stuff out there, but if you feel that you are being discriminated against, you should obviously reach out to your local legal action agencies. When to take action. Do not sleep on your rights, meaning you need to take action today. There are legal limitations and deadlines for filing both complaints and government agencies for filing any sort of lawsuits, depending on what the situation is. So you really want to take action immediately. So community response to discrimination and grassroots advocacy. So this is one of my favorite parts of this presentation. I'm not going to read all this, but this is from the Declaration of Independence. I'm somewhat of a nerd when it comes to like our Constitution. Like I went to DC and read the Constitution and was standing in front of it and cried. Like I'm one of those people. Again, the Declaration of Independence. So one of the sentences here is that whenever any form of government becomes destructive of those ends, it is the right of the people to alter or abolish it. Right. So this is our right. So if there are things that are no longer working for us as the constituency of our government, we have every right and authority to challenge those policies. right? It doesn't mean that we have to like go crazy and anything like that. We can organize though, right? And be professional and raise our grievances in a way that's meaningful and change policies to be and aligned with our favor in modern society. So that's what we need to do. And how do we do that? How do we respond? Understanding what current law exists regarding people with substance use disorder from federal and state lenses allows us as citizens to exercise our rights and mobilize grassroots efforts to make a change. So what is grassroots advocacy? Grassroots movement is one that uses the people in a given district, region, or community as its basis for a political or economic movement. So it uses our collective action and the local level to affect change on either local, regional, national, or international level. So getting involved in advocacy, if you feel that there has been some injustice, again, take action today and start to reach out to any advocacy organizations so that way you can, find out what's going on in your community, how you need to change it, and getting involved is one of the first steps. So some different agencies or organizations that you could get involved with is like People Advocating Recovery, the ACLU, American Civil Liberties Union, or Kentuckians for the Commonwealth. They're just a couple, but there are several. Bring everyone to the table. There is power in numbers. So working with as many people as you can to form your organization or to form your coalition to help build that movement to change policy. So developing your framework. Your framework is being whatever ask that you're trying to get across. So if you're working to enhance recovery housing, or you want to ensure that recovery housing can be available anywhere in a city or in a community, that's your ask, right? So how are you going to get to that end goal, right? Like what steps do you take? So here's just a brief outline. What is the story that you want to tell? What are your goals for that movement? Are you looking to change a law or a statute, or maybe it's an ordinance like zoning, for example? Who should be a part of your conversation, and when to get the media involved? And how do you plan to educate community members about your issue? Because the more people that you have, the louder your voice will be. So who are you connecting with? Everyone. School administrators, professors, family, friends, neighbors, coworkers, anybody that has been impacted, anybody who is providing services, anybody. Coalition building is the next big step, and that is bringing people together. No matter, your main mission might not be exactly aligned with somebody else who is still in the same fight, but might be different. People Advocating Recovery, we support recovery policy and recovery and removing barriers to treatment and recovery. But we align with Kentuckians for the Commonwealth, for example, who are working to enhance voter rights and access to the polls. So we collaborate and work a lot together, right? Even though we're very different spaces, but we still work together, especially on that issue to ensure that Kentuckians have the right to vote, that they can get to the polls, that they are registered to vote, and that they are an informed voter. So those are some of those coalition building efforts. So now we're getting to the community resources, and I see I am working pretty decent on time. All right, so change takes time. Change doesn't happen overnight, but it doesn't mean that you stop applying pressure. Pressure being your voice, raising awareness, bringing more people to the table. You just have to keep going. Sometimes, just like Dory says, you got to keep swimming. And that rings true in every sense of life, whether it's employment, education, going into school, whatever. Advocacy is no different. Just keep swimming. What is currently available? So different services that are available to you across the state. This is really specific to Kentucky. So harm reduction trainings, language of recovery trainings, which just help to empower people that are in recovery or the recovery conversation to be less stigmatizing. Expungement clinics, voter registration, and to know your right clinics, similar to this. So what is harm reduction? Harm reduction refers to policies and programs and practices that aim to minimize negative health, social and legal impacts associated with drug use, drug policies, and drug laws. Some local resources, and harm reduction. Also, like we need to expand, right? Like these are also things that we can work to expand on. The language of recovery. This training aims to challenge stigmatizing words and labels that have plagued our system throughout history. One of the first lessons that I can teach all of you today is to abolish the terms and words substance abuse from your vocabulary. I encourage you and challenge you to start using the verbiage of substance use disorder, or someone that has a substance use, because that, even the term abuse, although we know what it means, internally and cognitively, the way that we internalize the term abuse is through a violent sort of nature. So it just impacts you different, even from that one term, from that word. Expungement with Clean Slate Kentucky. So expungement, which is a legal process where an arrest, charge, or conviction are completely removed from your record. Again, we need to expand, but there are resources in the state. Voter registration. I think I talked a little bit about this with Kentuckians for the Commonwealth. They're a really great resource for that, as well as another resource that I listed here. And then knowing your rights clinics, the people advocating recovery, the ACLU is also another great resource that can provide similar trainings such as this one, to know your rights and to know how to respond when those rights may have been violated. I know I went through all of that very heavy content kind of quickly, and feel free, if you ever have any questions, you can email me directly, which I think I have my stuff here at the end in just a few minutes. But we have gained an understanding of how discrimination can manifest with people with substance use. We have reviewed the federal and state laws around substance use disorder, identified strategies to build an advocacy coalition through partnerships and shared policy agendas. And we have gathered additional resources on harm reduction care models, language trainings, and education materials. So now I do have this is my survey. This is not shatterproof survey. So if you want or can, feel free to do that. And I'm sure that Michelle may have one that will be sent to you guys that is theirs. No pressure though, obviously don't want you to have to fill out 2 surveys, obviously. But thank you so much, Michelle. And I think we are, right on time. I love it.
Fantastic. Thank you so much, Tara. And so folks can go ahead and scan the QR code there. I want to make sure you have an opportunity to get some feedback as well. I think we'll go ahead and start question answer with this slide up. So for all of our attendees, please feel free to use the Q&A feature at the bottom of your screen, and I will read the questions out. To get us started, I have one here. Along the lines of what makes a successful advocacy campaign. Does the approach change when advocating for a particular group or a protected class or community?
Yes, it does change. It depends on what all you're trying to advocate for, because policy measures and like through the legislature is going to be much different than an ordinance in your local community. I'll say though, there are particular themes that are very similar, right? Like educating stakeholders and decision makers, so that you're going to be educating them no matter what. So having your research, knowing your experts, things like that are going to be similar. But how you work with them is going to be different, and then also like how you educate is going to be different, and how long it takes too. Anything to do with state government and federal government takes a while to change. Sometimes there are like really incredible champions that can help push legislation quickly, but quickly could be 2 or 3 years. And that could seem like ages, right? To the person who is needing the service. But yeah, it definitely does change.
Thank you. And another here, how would you take action at different levels? And to help someone get the help that they need at that city, county level, or even statewide?
So depending on who or what sort of thing that you need, my first go-to is you should know who your representatives are. Whoever is in the state legislature, whoever represents your community, your mayor, if that, if it's a small town, and even, if you're a larger city, you should know who is your elected official. Because they should be a representation of your opinion, your views. Now, of course, community members, like, we are all very different. Everybody has different lived experience. So that individual is trying to represent, the collective many. However, they won't know what your opinion of something is unless you tell them, right? Email them, tell them, share that information with them, share your challenges and your barriers, because they won't know unless you tell them. And unfortunately, a lot of the time, that's where we in the recovery advocacy movement really fall short, is we don't utilize like that openness and that open space to reach out to them. And that's, for obvious reasons, right? Because we, that space has been heavily like stigmatized, criminalized, and a lot of different things. But you have rights, you have protections, we should use them. So now's the time.
Love it. Excellent. I'm seeing a few more come in, but if folks have any more questions, again, feel free to use the Q&A feature. This next one is, do harm reduction efforts serve to educate the public or to reinforce stigma?
Definitely educate the public. Harm reduction efforts are there to eliminate the harm of someone who may be using substances, and also those that around the community. So wearing a seatbelt is harm reduction. You're reducing harm for yourself if you were in a car accident. Wearing sunscreen, that's reducing harm for yourself from getting a sunburn. It's all kind of the same principles and practices. It's just that because substance use has been so stigmatized, we can't view it that way. And that takes education, right? Addiction is a public health problem, and we need to start viewing it with, that lens, or else we're going to continuously try to incarcerate our way out of the addiction crisis, and we're not going to do it. We have to view it from a public health perspective.
Thank you. I'm seeing this next question might be one for me. And if these slides will be emailed to us, the slide deck will be made available on the UNSHAME Kentucky website, but also for all of our webinar attendees, the post-event materials will be sent to you directly. Okay. And I think we can begin to wrap up this last question. Do you need to follow the research or evidence-based work that do or do not support specific responses to substance use disorder? I'm thinking this one is more along the lines of knowing the latest trends, knowing the latest studies, if you're just getting involved with advocacy work.
Well, you should, right? You definitely want to get a lay of the land. That's really important. However, it's not like your responsibility to do that. There are many, many experts in this space that you can call upon, right? That's the reason why like coalition building is so important. Because, even, I work in this space, but I don't pretend to know everything. Especially public policy, it's always evolving. It changes at minimum on a yearly basis, because we have a legislature that meets for several months and throughout the year that changes laws or adds laws, or modifies bills that we put up last year that this year looks totally different, but call it the same thing. So it is ever evolving. It is your responsibility as a citizen to be informed, but you can do that by asking the questions, right? Like that's how you become an informed voter. That's how you become an informed person, especially an advocate. When you're in the space and wanting to, start a movement or start an advocacy effort, on an issue. And most of the time I'd say, if you notice a gap or a challenge or a barrier, there's most likely somebody else that's out there that is facing the same challenge that you are. And you can find them and you guys can work together to make some changes.
Love that. There's an opportunity for everyone to get involved, to find their entry point.
Yes, absolutely. You do not have to be a professional to be an advocate either. I want to say that. Anybody, a mom, a dad, a daughter, a friend, a coworker, you do not have to be a professional in this space to be an advocate. Advocates are just people that have a passion for wanting to make a change in their community for the better, right? Like we just want to have a positive impact. That's what an advocate is.
Thank you. I'm not seeing any other questions pop up. So I'm going to go ahead and share the link for our next event, but also say an incredible thank you to you, Tara, for leading us through this presentation. We are so fortunate to have you a part of our community-based organization and partner network, and look forward to having you in future conversations as we continue to build out this advocacy platform.
Yes, thank you so much. Very glad to be here.
Excellent. So for those who are interested in joining us next month, we will be hosting a webinar on reentering communities and the workforce. Maybe it's from inpatient care, maybe it's after incarceration, but those who are returning to communities may face their own challenges, and we want to bring together a panel discussion of folks who are working in that space to set people up for success, give them opportunities to promote their recovery in the long term, and also support different public safety and public health initiatives. But thank you all for joining us. A survey will also pop up on your screen as you close out of today's event. I'll go ahead and leave this link open for a little bit so you can pull all the really good information out of the chat. But please feel free to reach out to us at unshamed.kentucky@shatterproof.org if you have any questions. I look forward to seeing you next time. Thank you.